We're going to now have a brief overview of what hypoxia is and cyanosis. Hypoxia is defined as a lack of oxygen to the tissues. So to be hypoxic basically means for some reason or other we're not getting enough oxygen into the system or to the cells themselves. And the cells need oxygen to be able to regenerate, to be able to work efficiently and effectively. So when we become hypoxic, we've got to first of all see the signs and symptoms. Agitation, aggression. As people start to get lack of oxygen to the brain tissue, the brain starts to react. So the person becomes a little bit combative, a little bit uncomfortable, a little bit erratic. You'll see the changes taking place, and always treat what you can see. Look at the patient. What is the patient doing? How are they presenting? Things like tripoding, where they're leaning forward, hands on knees, to allow the lungs to fall open. Gasping, shortness of breath, dyspnea, where they're difficult and laboured breathing. Lack of oxygen in the environment. What were they doing beforehand? What's actually created this lack of oxygen to the tissues? And remember, that has to be eradicated or corrected at its earliest point. And we can do that by opening windows, moving them into a clear environment, and placing the patient on supplementary oxygen. But remember, the patient may have an airway problem. They may have been choking, they may have something stuck in the throat, they may have a tongue occluding the back of the airway, they may have gone unconscious on their back, they may have fluid, vomit. Some barrier is stopping oxygen or air going into their lungs and then circulating that around the body. So it can also be heart problems, congested heart failures. Any sort of problem with the circulation will also create hypoxia. So the first thing we need to do is recognise it early. Somebody struggling to breathe, somebody looking a little bit agitated, a little bit unnatural. The next thing we need to do is look at the environment they're in and sort that out. And we also need to make sure that the airway is clear, patent, toileted, no vomit or fluid occluding the airway, and air can flow in and out at its best ability. And then we need to replace it, as we said, with supplementary oxygen. Cyanosis is a later sign of hypoxia. It's when the fingertips go blue, the lips and the ears start to change and go that deep blue colour. Seen very commonly with cardiac arrest when the head goes a very deep shade of blue due to lack of oxygen to the tissue. So you can be hypoxic and not cyanosed, but you can't be cyanosed and not hypoxic. Remember, cyanosis is a later sign, which means that by the time the patient becomes cyanosed, we really have got a patient that has got a severe airway problem that needs to be sorted out very, very quickly. Also remember, hypoxia and cyanosis in children comes on much quicker than it does in adults. Their circulatory system is much more efficient. Their oxygen and lungs and airways are much more efficient at taking oxygen on board. And children tend to die of hypoxic heart condition, in other words, lack of oxygen to the heart muscle. So one of the most important things about children and children resuscitation is not necessarily the resuscitation, but preventing the cardiac arrest taking place in the first place by supplementary oxygen, airway management, and looking after their airways to the best of your abilities. Remember, we've got a lot of tools in the bag to use: bag and mask, face masks, suction, nasal airways, OP airways, postural drainage, sniffing the morning air position, airway choking potentials with back slaps, abdominal thrusts. But remember, that airway needs to be clear, patent, working, and oxygen going in, and an oxygen-rich environment at all times whilst we're treating our casualty. Where this gets forgotten is when people put them into the recovery, or patients into the recovery position. People don't monitor the breathing. When they put people on spinal boards, they do the straps too tight. They forget that the patient is now completely in your hands, lying on their back. So if the patient suddenly goes unconscious, the tongue becomes a problem. They forget that the patient can't clear their own airway because they can't move to do so. So the patient is always in your hands and your control, and your airway comes number one and is the most important priority. Without that airway, your patient will become cyanosed, hypoxic, and potentially die. Airway must be maintained all times.